Hello, my name is Sarah Machado, and today I'll be interviewing Nancy regarding her diet and making better choices to treat her cardiovascular disease. Nancy is a 62-year-old female. She's single and lives alone. She's experienced a lot of medical emergencies in the last couple years that have really scared her. The first time she was at work and was experiencing chest pain. It was so severe that she was taken to the hospital for evaluation. At that time, she was not having a heart attack, but the doctor said it could be soon. The physician suggested a low-sodium diet and for her to stop smoking. The next time she experienced chest pain was at her grandson's baseball game. This time she was actually having a heart attack. The doctor had to perform an immediate quadruple bypass due to the blockage in her arteries. Nancy was able to stop smoking after the first ER visit, but changing her diet was more difficult. Since she's retired, she's able to do more cooking at home, which is good, but she's unsure of what foods to pick that are healthy for her. Let's bring Nancy in and get started. Hello, Nancy. My name is Sarah. How are you doing today?
I'm doing well today. Thank you for asking.
Good. So I heard you had quadruple bypass surgery. How are you recovering?
My recovery is going great. I'm getting my strength back and everything is checking out with my doctor.
That's good to hear. I'm glad you're recovering well. So we're here today to discuss the diet that your physician put you on. He's recommending a low-sodium cardiac diet. What do you know if anything, about this diet?
Well, I know I shouldn't be eating too much salt. It is hard to find what to eat that will be healthy for me.
Well, that's what I'm here for. By the end of this process, I hope you feel more confident about being able to choose the right foods for you. Your physician has prescribed you a 1,500 milligram sodium diet. Following a low sodium diet will help decrease the amount of fluid around your heart. The extra fluid around your heart puts unnecessary stress on your heart, which in turn will cause hypertension or high blood pressure. This is a symptom of cardiovascular disease. Okay, let's go ahead and get started. I just have some questions to go over first. Is that okay?
Yes, of course.
I have your stats from your last physician's visit. You are 62 years old, and you're 5 foot 6 inches, and your weight is 175 pounds. Is that pretty accurate?
Yes, that's what it was at my last doctor's visit 3 days ago.
Okay. Your chart also says you were a smoker. How long did you smoke, and how long has it been since you quit?
Yes, I smoked for 20 years. I tried so many times to quit, but I would always go back. I was finally able to quit before I retired about a year ago.
That is great work. You should be very proud of yourself for being able to quit. How has your appetite been? Has it changed drastically in the last 6 months?
My appetite has been a little off since surgery, but it's slowly getting back to normal. I would say I have a pretty decent appetite normally, but I typically eat the same thing regularly.
Okay, that's good to know. What type of foods do you like to eat for breakfast?
Now that I'm home more, I can cook for myself. I will make a cheesy eggs in the morning with some sausage or bacon. I don't drink coffee, but I'll have a soda instead.
Okay, now what about for lunch?
I usually make a sandwich of some sort for lunch, like a salami sandwich or a turkey lunch meat sandwich. Oh, and I'll have a bag of chips with it. I love to have the crunch texture.
Yes, I understand the love for the crunchy chip texture. Now tell me about your dinner choices.
For dinners, I normally have meat with potatoes and gravy. Occasionally, I'll have a cheesy vegetable casserole or regular canned vegetables as a side dish, but not often.
Okay, that's all good to know. What is your beverage of choice with your meals?
I normally have a Diet Pepsi with all my meals. I don't drink coffee, so I use my soda for my caffeine intake. I do not like the taste of water. If I do drink water, I need to be flavored with one of those powder packets.
Okay, so water is an essential need for the body, but in your condition with the edema in your legs, you should talk to your physician to see if you need to be restricting your fluids. But until then, maybe try infusing your water with fruits like a lemon, lime, strawberries, or oranges. Maybe that'll make it more appealing. Are there any foods that you do not like to eat?
I'm not really picky when it comes to food, but I do have a food budget that I have to stick to. Sometimes the fresh foods and lean meats are more expensive.
Okay, yes, I understand the need for staying on a budget. So you live alone, correct?
Yes, I do live alone. At this time, my daughter helps me with my shopping. But as I get stronger, I will start shopping on my own again.
Okay, good. That's a good goal to work towards. Do you enjoy cooking, or are you a quick and easy cooker?
I don't really like to be in the kitchen for long periods of time. I don't mind cooking, but I would like it to be quick and easy.
Okay. I love quick and easy meals. Now, do you have any food allergies, or what about any problems eating?
I do not have any food allergies or problems with eating. I did have an old partial that would bother my gums and restrict me from eating certain foods, but I was able to have it fixed and it doesn't bother me at all.
Oh, yes. Partials that do not fit well tend to cause sores in our mouth, which make it painful to eat. I'm glad you were able to get that taken care of. Now, tell me about your exercising habits.
Well, before my heart attack, I really tried to walk at least 30 minutes a couple times a week, but I didn't hold myself accountable. It was easy to forget it, and sit on the couch and watch TV. After my heart attack and surgery, I've been getting therapy. The physical therapist has taught me how important walking at least 30 minutes every day for the sake of my heart. Getting the blood pumping keeps my heart strong.
Yes, cardiovascular disease is very good for your heart. It is good to hear that you now know how important exercise is. Well, I think I have all my questions answered. Now I'd like to go over what your typical daily menu should look like, and talk about the healthier foods you can choose. So for the day, you should have a balanced diet of dairy products, proteins, grains, vegetables, fats, and fruits. It would be ideal to have at least 2 cups of dairy products, which could include a yogurt or milk, 6 ounces of protein, which would be beef, chicken, pork, cottage cheese, beans, peanut butter, or an egg, 4 servings of grains, including whole wheat bread, corn tortillas, dry cereals, and whole grain pasta. Vegetables that are fresh, frozen, or canned with low sodium or no salt, you will want to shoot for about 2 cups a day. And then 1.5 cups of fruit, which could also be fresh, frozen, or canned. So for instance, you said you wanted to stay on a budget. So maybe buying canned vegetables fits your budget better than buying fresh vegetables. You will want to read the label very carefully to make sure it says low sodium or no salt added. Like I have this can of sweet peas, and right above it says no salt added. You can also turn to the label and look down to the sodium, and you'll see that it has 10 milligrams of sodium, which is very low. The breakfast you've been having recently is going to need to change just a little bit. You'll need to decrease the amount of cheese that you're adding to the eggs. You could replace the regular bacon for turkey bacon. It has less sodium than pork bacon does. Maybe adding in a whole wheat English muffin or some dry cereal with milk would be a good suggestion also. For lunch, you said you like to have a sandwich. Choosing fresh turkey or chicken breast is a good choice as long as it's not processed. A lot of processed deli meats are higher in sodium. You'll want to check the label just to make sure you are aware of how much sodium you're actually ingesting. The chips on the side should really be avoided since they are going to be higher in sodium. You could replace them with crunchy vegetables like carrots and hummus, or celery and peanut butter for that crunch. For dinner, you said you like to have gravy with your meat and potatoes. The meat and potatoes are fine, but the gravy should be made with as little salt as possible. They do have low sodium gravy packets in the stores. You just kind of have to look for them. It would be good to include vegetables with your dinner. Like I said, if you'd rather get canned, just make sure it's no sodium or no salt added. Or you could roast some broccoli or cauliflower, which is pretty simple and quick in the oven. I've printed off some cheat sheets for you. The first one is a picture of a label and how to read it. On the top, you're going to have the serving size, which for this food is 1 cup. And the servings per container is 2. It's going to show you the calories, the total fat, cholesterol, sodium, total carbohydrates, and proteins. So on a low sodium diet, you want to be aware of the sodium levels. For this instance, it's 660 milligrams, which is quite high. I'll go ahead and give that to you. The next sheet I have is for healthy choices. In this section, it says limit these foods. You can eat them occasionally or as a treat. In the middle, it says check the label. You can usually find a lower sodium option from these ones. This section is for the low salt options, and you're going to want to pick most of your foods from that section there. The third sheet I have printed out for you is from the American Heart Association. It is explaining how to lower your sodium levels in just 21 days. For instance, week 1 you would focus on the bread and rolls and lunch meats. You would want to pick lower sodium items, track your sodium consumption. And week 2, if you are a big pizza eater or poultry eater, you're going to want to maybe decrease the cheese and meats on your pizza and add more vegetables. And then with your poultry, you're going to want to use fresh rather than processed, canned, or fried, since those will be higher in sodium. Week 3, it says to focus on soups and sandwiches. Here it says 1 cup of chicken noodle soup can have almost 1,000 milligrams of sodium in it. You're going to want to, again, look at the label and try and find lower sodium options. I have here a quick and easy dinner that you would think would be not too bad, you know, just mac and cheese, quick and easy, pop it in the oven or the microwave. But you can see, reading the label, it has almost 1,000 milligrams of sodium in there as well. And that is quite a lot for such a small meal. Okay, I know it can seem overwhelming what we went over everything today in such a short time. It will get easier as you go and as you learn to make healthier choices. Do you have any questions for me?
No, I don't think so. This was very helpful, and I learned a lot about what types of foods I should choose to eat. Thank you.
Good, thank you. It was nice to meet you.
Nice to meet you too.